Greetings to you wherever you are in the world. My name is Wendy Osborne, Senior Consultant with IAVE. And on behalf of IAVE, I am delighted to welcome you to our 2021 Thought Leadership webinars. A short series of 4 webinars between February and May on the theme of volunteering for social change, with a particular focus on volunteerism and social activism. Please note that the webinars will be recorded and available on the IAVE website. I would quickly draw your attention to a few of the features on the Zoom control panel. If you're having trouble hearing the presentation using your computer audio, try switching your audio settings to phone audio to call in. Please also note the raise your hand icon. During the session, the presenters may ask participants to raise their hands to provide non-verbal feedback. Perhaps the most important feature I would draw to your attention is the question and answer icon. Please do send in your written questions to the panel. We really value your participation. This third webinar in the series continues the theme of volunteering for social change, with a particular focus on volunteers taking action to support the recovery from COVID-19. The world continues to need volunteers to step forward, to provide practical action, and to advocate for action by those with the power to make people's lives better. Whether it is rolling out the vaccine or improving economic sustainability for all, grappling with the effects of the pandemic and building resilient communities is a role not just for the few, but the many. That is why working collaboratively to address these issues will provide more effective outcomes. Our moderator for today's session comes with a wealth of experience of community engagement and development. Matt Clausen is the Senior Advisor to the 100,000 Strong in the Americas Innovation Fund, an initiative to support dynamic higher education partnerships, increase student training and exchange opportunities, and strengthen regional education cooperation and competitiveness throughout the Americas. Previously, Matt spent 15 years in the senior leadership of Partners of the Americas, a non-profit organization that brings together people, governments, and local organizations to address challenges in the hemisphere, including building resilient civil societies and by promoting citizen engagement and transparency. Currently, Matt is also Deputy Chairperson of the IAVE Board of Directors. Thanks again to you, Matt, and our 2 esteemed panel members. Matt, it is now over to you.
Thank you very much, Wendy, and good morning, good afternoon, good evening, whatever time of day it may be where you are. And I think I'd like to start with that note as we are embarking upon what should be a great conversation with our fantastic panelists to talk about issues that use words like recovery from the pandemic. The pandemic itself, depending on where you are and what your situation is, you may not feel that you're in recovery. You may feel that you're in darkness. Maybe you feel hope of vaccine, and maybe you do not. And that's just like it is morning or evening or night in different places in the world. The pandemic in itself has impacted us all, but all in different timelines and in different ways. Just today in some parts of the world, in the UK and others, there's a relaxing of some stringent measures that had restricted people's movements in societies. In other places, they're entering a lockdown. But there is no doubt that as a pandemic that has now taken almost 3 million lives across the world, and is in fact, as of several weeks from now, we'll probably have more cases in the world than we've had since the beginning of the pandemic, active cases. So we are talking about recovery because we do have a bright light in the sense that we have viable vaccines, but how those vaccines reach people and when they reach people, depending on where they live in their own situations, is a very challenging situation. There have been, as of last week, 673 million doses of vaccine in 155 countries across the world, but that's only for 7.5% of the global population. 10 countries have received about 80% of the vaccine doses to date, and 30 countries haven't seen a drop yet. So there is hope, but there is despair at the same time. As the pandemic has brought us moments of despair, volunteering and our communal response to the vaccine has brought us much hope. And I think it is with that spirit, as we have this conversation today, recognizing that for all of you, where you are on that spectrum of hope, despair, recovery, or in the thick of it, we recognize that the pandemic hits everybody at a different way in a different time. So the importance of volunteers has been critical in responding to the pandemic. And as we commence in many parts of the world, a recovery stage, not just a recovery from a health and epidemiological standpoint, but a recovery from the many side effects that this pandemic has had related to poverty, unemployment, economic, educational, and just the importance of building community resilience moving forward. And a key issue that comes out of the global lessons learned regarding has been increasing the effectiveness and the importance of collaboration to confront what is a very novel situation that we haven't seen at this scale for 100 years in the world. And our panelists today, who I'll introduce in a moment and then turn the floor over to them, are excellent case studies of leaders who have mobilized networks in their countries and communities to help react to the unknown and work towards having the most positive impact possible as we have run the course and continue to move forward in our collective response to the pandemic. So if I may introduce both of our panelists first, and then I will pass the floor to Gloria, to Denise, who will start us. But we have Denise Hayward, who's the Chief Executive of Volunteer Now, Northern Ireland. Denise has been the Chief Executive with Volunteer Now since August of 2017. And prior to that, was the Director of Engagement since 2010. She has extensive experience in public and organizational volunteering, policy development, local volunteering, infrastructure engagement, volunteering research, and supporting good practices in volunteering, young people in volunteering, older people volunteering, and events volunteering. And she has knowledge of and expertise in working with volunteers and volunteering issues gained over many years working in the voluntary and community sector. And Denise is also an active volunteer herself for Armagh Talking newspaper and Tier Fund. So Denise will first speak, and then following Denise, I will be introducing and passing the floor to Gloria Arlini, who is the Deputy Director for Strategy and Policy at the National Volunteer and Philanthropy Center in Singapore. Gloria has over 12 years of experience traversing the public, private, and people sector across Singapore and Indonesia. Growing up amidst multiple cultures, she holds an innate curiosity of people and is passionate about using stories and lived experiences to create common grounds for understanding. And she is currently the Deputy Director of Strategy and Policy at Singapore's National Volunteer and Philanthropy Center, Nvpc. And in this role, she heads up Collabs, which she'll be speaking about today, which is an initiative to bring multiple stakeholders to develop community-based collaborative approach to address today's complex social issues. Denise and Gloria each bring their own perspective. They will each present for approximately 10 minutes, during which time you're welcome to start inputting questions through the Q&A box in your screens as Wendy outlined, so that following their two presentations, we will reserve what I hope will be a robust third section of this webinar to be able to have the conversation continue based on your questions. So without further ado, Denise, I would like to pass the floor to you.
Thanks, Matt. That's great. I just want to check, can everyone hear me okay? Yes, I hope so. So I'm, as Matt introduced, I'm Denise Hayward. I'm Chief Executive of Volunteer Now, which is a regional support organisation for volunteering in Northern Ireland, which is part of the United Kingdom. Jessica, can we have the next slide, please? So Volunteer Now is made up of two different organisations. We're a charity and we're also a social enterprise. Our role is to provide recruitment support for volunteers, to promote volunteering opportunities, to provide information, policy, research about volunteering, and also direct engagement of volunteers through a number of different projects. And that's really going to be a main part of my focus for my presentation today. We also provide through our social enterprise, Volunteer Now Enterprises, extensive training, both on volunteer management, on safeguarding and on governance. So next slide, please. I just wanted to start by reflecting, excuse me, on how I feel volunteering has responded in what has been really the first year of the pandemic, and what are the challenges and kind of key learnings for us as an organisation, which I thought might be useful to reflect on for everyone today. And then I'll go on to talk about a specific project that we have been undertaking in volunteering in supporting the delivery of the rollout of the vaccine programme in Northern Ireland. So first of all, in terms of reflections, I suppose one of the things that I've been observing is that volunteering has changed over the last 12 months. However, some of the ways that it's changed are actually things that we have been beginning to see trends emerging for the last number of years. But actually what's happened through the pandemic is that those changes have really been sped up because we've suddenly been living through a much more stressful and difficult time. And so some of the things that had been posing a question to volunteering more generally have now become something that we really have to face and address much more quickly. So for example, the rise in informal volunteering. In Northern Ireland, we saw a massive outpouring of informal volunteering about this time last year. And so much so that, you know, as an organisation, we had probably double the number of people who register in a year register in the space of 3 weeks. We had such a wealth of people coming forward to volunteer that it just physically wasn't possible to place everyone or to offer an opportunity to everyone. So that massive rise in informal volunteering is something that we have seen. It is something that's been part of the volunteering story in the UK, certainly for many years, but it's not so well researched or not so well documented as maybe more formal volunteering with an organisation. And so therefore, it's probably been a bit below the radar and not everyone has been as aware of it as perhaps they should have been. But one of the things that it's really taught us is that our society will mobilise, people will respond to the call. And I think that gives us great hope for the future. And as we begin to think about emerging from the pandemic, certainly one of the things I and my staff are looking at is how do we really harness that involvement, that energy that was here through the pandemic and keep that going to support organisations as they start to rebuild, which they will need over the coming weeks and months. And we saw a lot of that episodic, that spontaneous outpouring of volunteering, which you always do see in the response to any emergency situation. But the key challenge for that is how you get that embedded. We're very encouraged. We've been doing some research tracking volunteering in Northern Ireland, and we are seeing high numbers of people who stepped forward for the first time through the pandemic, actually wanting to continue and carry on when the pandemic is over. And that is encouraging. And I would hope that's something that on a global basis, we will see that this is an opportunity actually to bring perhaps new people forward into the volunteering family as time goes on. We've also seen quite substantial changes in volunteer roles. Some of the things that we've all taken for granted for many years in terms of that face-to-face engagement just haven't been possible. And we've all had to look for new ways of doing things. And I think some of those things are going to stay with us permanently. I don't think we're going to see the end of virtual volunteering, doing things online just because we're able to go back to face-to-face. And we're actively looking at how we can blend that face-to-face, which will obviously want to come back, but with also some of that online things that we've been learning over the last number of months. We have seen rethinking of old roles, things that we always thought were a given, we're doing in different ways. So for example, Volunteer Now delivers befriending projects for older people. And we always thought that that had to be done always face to face. And for the last year, we've been doing that by telephone. Now, I still think there's definitely a place for face-to-face, but what I think this has taught us is there's a place for both. And I think what we're saying is, a change in trying to grapple with, changing roles, and rethinking things, and seeing how we can bring on board some of that learning that we've had from the last year to enhance and improve the services that we've been delivering all along. And then the last thing I wanted to talk about in terms of this reflections piece is just that business of changing expectations. We have seen a really big change in who's volunteering over the last year. We have seen a lot of older volunteers who would have perhaps been what we would have called the kind of bedrock of our volunteering, stepping back because for health reasons they haven't been able to volunteer, they've been worried about leaving their homes, and so they haven't maybe been able to give the time that they normally would. However, what we have seen is a lot of new people then coming into that space, but their expectations may not be the same. They may not want to do the same number of hours that perhaps some of the older volunteers have done. They may want to approach things slightly differently. They may want more control of their volunteering, more kind of running their own organizations, doing those kinds of things more as a movement rather than individuals who just simply accept a role that they're given. So we have seen real change. One of the things I'm really conscious of is we're also losing perhaps a wealth of experience, because people who have been volunteering in some cases for decades maybe have stepped back. And one of the things we really need to do is trying to find new roles to keep those people involved who want to continue that involvement, and then also to encourage those new people to come forward and be meshed into the volunteering team. And I think now is a really important moment for volunteer managers in that space to be doing all of the work behind the scenes and building those relationships and building those partnerships with other organizations as well, that allow people to have the opportunities to volunteer that they need and that they want in order to make the difference in the communities that they're part of. So if we could move on to the next slide, please. So Wendy asked me to speak today about our partnership approach to supporting volunteering in the vaccination programme. We started this piece of work in late November 2020. It was a very quick turnaround, as these things often are. I think vaccines have been talked about for a long time, but suddenly ours was here and we had to respond very quickly to putting together a partnership and putting together an approach to managing the volunteering aspect of the vaccination programme here in Northern Ireland. We had conversations very quickly with partners within the public sector and with other voluntary organisations. We were helped by the fact that we already had good relationships in place, and that definitely made a difference because we already had trust, and it really helped then as we were beginning to build a partnership. I suppose we in the third sector, as part of the partnership, had a vision that we wanted there to be a more structured approach to volunteering in emergency response than perhaps we had seen, and we felt that this was an opportunity to test it and to try to do something a little bit different. And that was one of the big motivations in terms of bringing the partnership together. We wanted to provide a governance framework for a number of partners to be involved, because we realised that one organisation would struggle to do all of this by itself, particularly for the time that we had to do it. We started our first volunteer deployment just the week before Christmas in late December, and we're still going, and we are likely to still be going through May, possibly June, and into July at least. So we anticipate, for a long period of deployment of reasonably significant numbers of volunteers, and we wanted to build a sustainable model that would allow us to carry that through over that period of time. And we also wanted to have a good quality experience for the volunteers. That was really important to us, and we wanted to make sure that we had a partnership which we were building for the future that would involve a number of organisations. We have the next slide, please. So our partnership is made up of the British Red Cross, Volunteer Now, and Ulster GAA. Our role in the vaccination centres is to provide a meet and greet service, so volunteers support members of the public as they come through the vaccination centre reminding people about social distancing, reminding them to wear their masks, reminding them to use the hand sanitizing equipment that's there, and pointing them in the direction, navigating them through the centres. There's a very high volume, so lots of footfall through these centres. They're very busy places, and it is easy, and particularly when we were vaccinating in the early part of the rollout, where you were vaccinating people who had maybe in some cases literally not left their house for months on end. You were dealing sometimes with people who were very vulnerable, people who were sometimes very frail, who had very limited physical activity over the last number of months. So therefore, it was so important for them to have that support and that care as they came through the centre. And that's the very important role that the volunteers have been playing. I know elsewhere volunteers are providing the actual vaccination, but not in Northern Ireland. In terms of our partnership, we're working with British Red Cross, who are obviously very experienced in terms of emergency response volunteering and have brought that very clear experience to the partnership. Ulster GIA is the largest sporting organisation on the island of Ireland. They have a huge number of volunteers, mostly normally refereeing matches and managing crowds and different things. So they also had a lot of experience and skill to bring to the party. And we in Volunteer Now have a substantial amount of experience of larger scale volunteer deployment, particularly managing using pieces of software to allow people to book shifts and to do things very quickly and efficiently. And that was a really useful piece of work from our point of view. So our outcomes so far are from the 4th of January, the 24th of March, we have delivered just over 15,000 volunteer hours. We've had over 300 volunteers. I can tell you that I've just checked the figures today, and now we're over 20,000 volunteer hours, and we've had again another additional 60 or 70 volunteers, so we're nearly up to 400 in total. Our vaccination centres in Northern Ireland are running 12 hours a day, 7 days a week in some cases. There, our volunteers are operating in 2 shifts per day, generally a morning and an afternoon shift, and we're making sure that they're having a good experience through working as a team and enjoying each other's company. And we are anticipating, as I said, that this will carry on at least until May and possibly beyond that. So if you go to the next slide, please. So the 2 roles that we have in our volunteer rollout at the moment are the meet and greet that I've discussed in terms of supporting people navigate their way around the vaccination centre. And the second role, which is actually really vital for us, is the team leader role. And the team leader's role is very much about making sure that the volunteer meet and greets people are having the best experience possible. So it's about ensuring they get breaks. It's about ensuring that there's clear information provided to them on the day if there are any changes, and also that opportunity to give feedback and take that feedback through to the staff team that's supporting them behind the scenes. So both roles really important, both roles working together and dovetailing really well together. We have selected some new meet and greet volunteers, people who are unknown to us, and we have worked through a selection process with them. The majority of our team leaders are people who have volunteered with us over a number of events, a number of years in some cases, and people that we've got to know. Although even in that space over the last couple of weeks, we've been integrating some new team leaders who are relatively new in our volunteering team. I'm going to go to the next slide, please. So just to say a little bit more about the training and support that we have provided to the volunteers. So as I mentioned, we have the team leaders on site all the time, but we have also had staff members on site most days, just making sure that everything's running okay. With any process like this, there's been lots of change. You know, the centres were set up initially, and then, you know, after they've been running a few days, they've maybe changed different processes, done things differently, and we have to make sure that volunteers are fully briefed and up to date with all of that. And there's quite a lot of work just making sure that that happens. In terms of induction and training, we provided initially an online resource, which is we emailed out to all of the volunteers who wanted to take part, because we just literally had such a short time to turn this around. We didn't have time to do any kind of face-to-face online training at that stage. We just had to simply get the basic information out there. The kinds of things that we've covered in our training are things like just the background to the vaccination programme, the geographical locations of the vaccination centres, physically how they got there, how they would park, how they would just access all the practical arrangements that people needed to know. We also walked them through what the centres would look like and how they would operate and the kinds of things that people would be asked to do as volunteers. So we looked at the detail of each written role description, looked at the different aspects of those and gave people an opportunity to just learn more about what we wanted them to do. So we also looked at things like personal protective equipment, what they would be provided with, whether they would have access to the vaccine themselves, which was a very big question in the early days. We had a long conversation about risk management and how they would mitigate the risks to themselves of being part of the vaccination programme. We looked at things like hand sanitizing, and then we also have a health questionnaire in place for volunteers. So if you come to your shift, you're asked to complete a self-declaration form just to simply say that you have no symptoms and that you're feeling well and that there's no reason why you shouldn't be volunteering. We also looked at all the practical arrangements such as breaks and uniform and mileage claims and how they got their lunch and all those practical things that make a difference between having a okay volunteering experience and a better volunteering experience. And we spend a lot of time in the training as well looking at things like code of behaviour, our values. I mean, bringing 3 organisations together who have very different backgrounds and very different purposes, but we find shared ground in terms of our values, and we spent a lot of time in the training making sure that we were communicating that to the volunteers. Looking even at things like how they dress to make sure that everybody felt welcome in the centres, that things were done in a neutral way. In Northern Ireland, that's a very important thing for us, that everyone in the community feels welcome. And so therefore our volunteers had to be part of building that welcome for everyone. Social media, how they use social media, things they could say, things they couldn't say, things they could do. Just how we treat one another with respect and how we make sure that everybody feels that they're valued and part of the team. So those are the kinds of things that we spent time on in the training. And then we followed that up since then with a series of webinars where we've had more detailed discussions with team leaders. We've had opportunities now that the centres are up and running to go into more detail about some things. So we've continued that communication. And just at the moment, we're also doing a series of things like deaf-blind awareness training for volunteers. So we're just continuing to build on that training experience and that engagement that we have with our volunteer partners. And then every week on a Friday, we have our e-flash, which is a really important part of that. So that allows us just to let volunteers know what a brilliant job they're doing, to say thank you for the week that's just passed and what they've done, and reflect on the number of hours and the time that people have given and all of that. And just to really give people that pat on the back and that well done. It's also an opportunity for us to update them on any change or any new information, anything like that. So those means of communication, that regular support, dealing with email queries is a big part of the staff's role, making sure that volunteers have all of the support and information that they could possibly need to be able to do their role as effectively as possible. And you can see that picture there. That was a couple of weeks ago in one of the centres, and that's where we hit the 50,000 vaccine people who've been vaccinated in that one centre. We've gone well beyond that now, which is lovely, but it's just important to mark those milestones as well, and that volunteers see their role in making that change. And I mean, I think from our point of view in Volunteer Now, it has been a fantastic experience to be part of something so positive, because I think what Matt said earlier is absolutely true. We've all been through the good days and the bad days over the last 12 months, and I certainly feel that we in Volunteer Now and our team definitely feel that it's part of a good news story at the moment, and that we're really seeing throughout the pandemic that volunteers have been at the heart of making a huge difference to our communities and really taking the edge off what otherwise would have been a really horrendous experience, and allowing people to have a little bit of hope in the middle of all of this. So my last slide is just contact information and contact details. If you want to get in touch afterwards with anything, if you want more information about any aspect of my presentation, please don't hesitate to get in touch. And that's me done. Thanks very much.
Thank you, Denise. Thank you for your generosity in sharing your general reflections on the voyage that you and your partners have taken, and also the really helpful, detailed information about how you are mobilizing volunteers. It's incredible work. I'm going to shift and pass the floor to Gloria Arlini, who will now speak to us about her experience from Singapore. Keep the questions coming in. We are receiving them. And after Gloria speaks, we will have a Q&A session. Gloria, the floor is yours.
Thank you very much, Matt. Hi, everyone. It's 9 p.m. here in Singapore. It's a pleasure to be here with everyone. Thank you so much for joining us. So before I start, I will take a little bit of time just to share a little bit more about what Nvpc does. So we are the National Volunteer and Philanthropy Center. We are based in Singapore. Essentially, we are the national body that is promoting giving in all its forms in support of any and all sector. So it's not specifically geared towards vaccination or towards any particular cause, but we are supporting everything. And just to clarify, we are not just volunteerism and philanthropy. It is not, although certainly these two areas are key to what we do. It is how we started. It is very much central to what we do. But increasingly, what we have realized over the past few years, especially, is that giving is taking multiple expressions, especially in Singapore. And whereas people are still very keen in contributing their time and their effort in volunteerism, we are also noticing other forms of giving emerging. And that kind of leads us to a recasting of our vision to be broader and more ambitious. Next slide, please, Jessica. So about 2 years back, we have sort of sharpened our vision, and how we see our vision of Singapore is one of a city of good, right? And this is essentially where we see and envision people, organizations, leaders coming together to really give their best for others. What does this mean? Essentially, we see this as how people moving away from that me first mentality. We want people to get in touch with the innate goodness, and life just happens, and sometimes people get self-centered and get caught up. But what we want to do is to move this to become more other-centered in their approach. So essentially how we see this is giving being part of our DNA. Giving is part of who we are, how we live our everyday life. When it comes to organizations, we want goodness to be at the heart of every organization, and we want leaders in the community to raise other leaders along the way. So essentially our mission is to grow the culture of giving at a national level. Next slide, please. And really nowhere has this been better exemplified than during the COVID period, right? It is such a massive crisis that defies many experiences that we have seen before as a nation, and we are really astounded by the outpouring of generosity that we have seen. So I've just put together a couple of montage of pictures here based on some of the stories that we have heard on the ground. And this is just to illustrate some of the really heartwarming things. So I'll just move quickly from the left to right. On the left side, I don't know whether you can see, but there's actually a little girl kind of like pasting up an artwork of sorts on the window. So this is a typical flat that many Singaporeans live in. And although this was happening during the movement control period, what we call the circuit breaker in Singapore, this was really an expression to encourage healthcare workers and frontline workers that are working sort of outside. The second picture is a lady. This was, during the period when the movement restriction was somewhat relaxed. And this lady, her name is Limei, she's ferrying a neighbor who is obviously a wheelchair-bound elderly to a nearby dialysis center. So this is an expression of neighbor helping neighbor, which was really picking up during the height of the circuit breaker period. The third picture is a friend, actually, Stanley. So he volunteers as a swabber during the migrant workers dorm outbreak period. And I think there was really a huge, massive call nationwide for healthcare professionals, or even just those without any healthcare background, just to come forward, because it's such a operationally taxing exercise. And this is one expression in which even somebody without any healthcare experience come forward. The last picture is of Mei En. So she volunteered with this organization called Engineering Good. And they're a very interesting group of people who are really, you know, not necessarily just engineers, but people with some repair background, technical backgrounds. And their expertise really came to the fore during the home-based learning period. So during the period where where schools were closed, where students are, you know, sort of learning from home and all the lessons kind of move online, people from low-income families, children from low-income families are sort of caught struggling because not many of them have access to laptops, radio laptops, and therefore there is an outpouring sort of support in terms of people donating their used laptop, and there's this need for volunteers to come forward to repair them and make sure that you're refurbishing them and then delivering them. So here are some of the very interesting sort of expressions of goodwill that we have recorded amidst COVID-19 crisis. Next slide, please. And so that was sort of, you know, what we have captured throughout 2020. And in Nvpc, we also run a national giving platform. It's essentially an online platform. We call it giving.sg. It's a national platform where individuals can sort of come forward to donate, to volunteer for their preferred causes, to even start a campaign on their own. And so we have sort of, we have captured all this data in our database. And what we have discovered is really quite astounding. So we have hit a record-breaking 93.4 million Singapore dollars donation throughout 2020. And I've put together sort of two charts here. The first chart on top is a donation amount, and the bottom chart is on the volunteer sign up on the platform. So for the donation amount, the yellow chart kind of illustrates the trend in 2020 as compared to the green line chart, which illustrates the 2019 trends. And as you can see, there is just an outpouring of generosity from Singaporeans. So we hit, I mean, that's easily year-on-year comparison, more than 2.5 times that we have hit in 2020. So that was the highest ever for us. And likewise, even for volunteering signups, right? I mean, you would have probably assume that during the movement restriction order, there is, you know, people tend to hold back a little bit, and people are probably being very wary because of the health risk. But what we have seen is also really interesting. So in Singapore, the movement restriction order kicked in April. So that's sort of like, that's a period where, you know, the heaviest sort of restrictions were in place. And naturally, you kind of see that the volunteerism rate dropped during that period in the month of May specifically. But quickly enough, as soon as we relaxed this and we have, and the country kind of reopened back in mid-June to July, you see the rate climbing up again. And as a whole, when you compare year on year, actually, even during the crisis period, the volunteer sign up has continued to be very, very encouraging. So that's really very heartening for us as sort of, you know, the body that is tracking all this outpouring of giving and volunteering. Next slide, please. So of course, to sort of recap the year in 2020, we typically end the year by having a national sort of giving week. So this is our version of Giving Tuesday. So we kind of extended it to whole week. And as well as a President's Volunteerism and Philanthropy Awards, which is really sort of the pinnacle of a volunteering award that we have in Singapore. And, you know, it received, this outpouring of goodness really received the most fitting validation at the highest office of the land by the President herself. So that's President Yaakob. And we also have received historical growth of nominations. This is public nominations for anyone whom they see to be deserving of being considered for this honor. So we have received 236 nominations within 2020, which, as you can see, compared to the earliest years, it's easily 2 or almost even 3 times. So that's really a recap of what's happening for us during the COVID relief period. Next slide, please. So sort of after everything settles, after the dust settles, we kind of find ourselves, you know, in 2021, kind of standing at the beginning of that road to recovery, right? Asking what's next. And so I really like this particular quote from Klaus Schwab from WEF, where, you know, he recognizes that, hey, COVID has caused disruptions of epic proportions, right? And life sort of will never be the same again. And the keywords that he picks up, right, disruptions, and there's this subtext of like, the problem that we are facing today is so massive and so complex that there's no single stakeholder can identify themselves as, hey, we got discovered, right? There's no longer that kind of easy identification of who should be playing that role to address this, whether volunteer or government or otherwise. So almost there's a subtext here that there's the only way forward is really through partnership, through collaboration, right? Denise talked about this earlier in terms of how people come together and form stronger partnership and ways of working together. Next slide, please. So for those of you who might be familiar with this, the notion of complexity, essentially we find ourselves in the space of emergence as as 2021 rolls forward. And we face problems whose origins are uncertain. If you look at the chart on the left, right, the origins of the problem are uncertain. The solutions are also, not quite agreed upon. People are still discovering things. Certainly, we are not in the anarchy or in the chaotic setting anymore, but neither are we sort of, able to go back to what we knew before in terms of, a very distinct identifiable problem with a distinct identifiable solution. But what we find ourselves is largely in the space of complexity, right? The orange space in between. And just as a very quick sort of snapshot of what's the textbook definition of complex problems, these are essentially problems that have no widely agreed upon definition. These are problems that have no single root cause. It defies easy identification and easy solutioning. So this is really the situation that I feel we are increasingly facing, especially in the recovery phase. Next slide, please. And if I were to conceptualize sort of the situation that we face into one sentence, this would be something like, how might we drive collaboration among the public, private, and people sector to address complex social issues and co-create solutions for lasting change? Because really, I think it's not just a case of simply taking action, right? It's how do you then, as Denise alluded to earlier, how do we make sure that people are taking action and sustaining it so that it creates a more impactful and meaningful change going forward? So this is really underpinning what we are doing in Nvpc. One of the programs that we do is called Collabs. And this is not something that we have recently came up in response to the crisis period. We have actually done this for about 3-4 years back. But I think in a way it has seen sort of like a new articulation of importance of how we articulate a new the same problem from a different lens. And therefore we are also, the team is experimenting and trying to sharpen our understanding of how do we then apply this collaborative approach to address emerging complex issues that are abound around us. Next slide, please. So essentially, this is what we are doing in a graphical format, right? So on the left side is the typical way in which how people solve problems, right? You have stakeholders, occasionally they kind of come together and form periodic partnerships. But what we are trying to do here is to shift them towards the right side, which is that, hey, stakeholders come together and let's see how we can collaborate and work together in a way that is more sustained, and underpinning all that is that shared aspiration and understanding. And this really requires a different way of approaching the issue and having that kind of humility and that kind of patience to probe the issue and sense make it before we then decide how we can respond to it together. Next slide, please. So this is just sort of the 3 principles. This is articulated in 3 principles and 3 phases with which we approach collabs, the collaboration process. So very important to us is being able to really empathize, right? Being able to really walk a mile in the shoes of the community or the beneficiaries group. So we start with empathy. And then from there, we try to expand that cognitive understanding by recognizing that there are so many different stakeholders in the space, all of whom have different understanding and different ways of approaching the issue. And therefore, from there, how do we then build a community so that building on that shared understanding and multiple pieces of information, how do we come together and create a more holistic solution? So this gets articulated in the 3 phases of learn, align, and then acting. Next slide, please. So in the next few slides, I'll try to articulate and sort of illustrate this in using the migrant workers collabs that we have recently concluded back in November. So we have just launched the report arising from this engagement. Next slide, please. So I'll just quickly recap about the situation in Singapore and why we are looking at the migrant workers. So Singapore is a small country. We are just shy of 6 million population, and we are vastly reliant on migrant workers to build our economy. In fact, the migrant workers comprises around 1/5 to 1/6 of the total population, and they're really the backbone of our workforce, especially in the construction, marine shipyard, and process sectors. And a huge population of the migrant workers are living in the dormitories because of, simply the massive number of people here. And typically these are purpose-built dormitories, right? This is a high density living situation. Each dormitory could go up to anywhere from 3,000 to 25,000 pax even. And of course, there are some other forms of accommodation, right? You have private residence, you have factory converted dorms and so on. But primarily we have massive high density dorms here. And because of that situation, certainly when a crisis like COVID happened, there was massive outbreak in the migrant worker dorms. And in fact, at the peak, migrant worker dorm outbreak comprises about 90%, over 90% even, of all COVID cases in Singapore. So suddenly, the migrant workers being previously falling in the blind spot because of this very contained, very specific group of demography, suddenly they became thrusted to the limelight, right? Everybody is wondering what should we do, right? What can we do in response to such a massive crisis? Next slide, please. And certainly there have been many efforts to come where volunteer-driven efforts are coming forward, right? There are many help. Volunteers are coming in droves to provide food, personal items, information, translation, and so on. But all these are also massive, but also kind of siloed efforts. And therefore, when we realize the need that we need to bring people together and just, trying to put together the different parts of the puzzle, collectively, we come up with an aspirational statement with all the stakeholders, which is how do we then improve the quality of life for migrant workers for a better Singapore of all? And the last part is so crucial because now we increasingly realize that this group of population is not just, a separate segment removed from the rest of Singaporeans, but when we can improve the quality of life of the migrant workers, all of us as a nation also are able to benefit at the same time. So that's really how we are seeing this as a collective aspirational statement. Next slide, please. So we designed then a process of engagement that spans about 4 months. So we had a series of 5 sessions where we bring different stakeholders together, and we had an outpouring of interest, really. We had 105 individuals across 53 organizations, and these are sort of across 10 different organization types. So you have nonprofits, we have foundations, we have government sectors, and so on. And together we grapple with, we try to understand the issue from multiple perspectives, and we have different thematic focus for the 5 sessions, starting from stakeholder mapping, map refinement, all the way to areas of opportunities. So I'll just give some, next slide, please, Jessica. So I'll just give some sensing of what kind of output we came up with from these engagements. So there are 3, these are the selection of maps that we came up with because we felt that there is a lack of understanding of what is really the issue, who are the stakeholders, and how do people see. So we thought that this is a wonderful way of starting the process so that people don't just take actions blindly, but they have a common vocabulary. Next slide, please. So this is one example. It's a little bit small, but this is the stakeholder map that we came up with, where we kind of trying to understand who are the different stakeholders really. And for each stakeholders, and you can see here, right, for the migrant workers, you are not just working, they also hang out, they also have recreational activities, spiritual activity. What do this look like? What's the constraint and what's the enabling factor for each of these stakeholders? Next slide, please. We also have, we speak to the migrant workers themselves and just trying the whole empathy part, right? Trying to understand, so what is it that, what makes you tick, right? What are your pain points? What are your joys, right? And we try to understand this more closely so that we are able to provide a more targeted intervention. And lastly, next slide, please. And this is also sort of, we call this a causal loop map. So this is essentially how we identify the interrelatedness of various factors surrounding the migrant workers' lived experience. Next slide, please. And from this, what we put together is sort of a mapping of different areas of opportunities. Along the way, as an organizer, we also try to do a bit of a matchmaking, right? So many stakeholders and different stakeholders have their own pet topics. So where it's possible, as an organizer, as sort of as a central body, we try to see where the opportunities to pull these different stakeholders together. How can we encourage them to facilitate their volunteers to then work together in partnership towards creating a greater impact? And being able to come up with sort of like a blueprint of sorts, right, for people to base their work on going forward really, really helps. Next slide, please. So this is sort of a sensing of what we have done. So this is our sort of our map, our stakeholder map, our initiatives map. And what we have done is to identify those 5 pillar areas and who are the different stakeholders who have expressed interest in those. And from there, we are currently tracking this range of collaborative actions. So you can see it range everything from improving dorm management practices to pursuing advocacy of migrant worker rights, right? So because it's not a given that people are interested in doing the same thing. The next slide, please. So I think what we have discovered through this extended process is certainly the ability for it to give a leg up to improve the efficacy of volunteers taking action, right? I think harking back to the topic of today's discussion, it's not just a matter of volunteers taking action, but also how do we then encourage them to play that key role in sustaining impactful collaborative efforts. So what we have seen is that, you know, here are some of the areas that have been seen as the next step, next phase of how we can engage more volunteers. And this was recently announced by the ministry representative. So we're talking about tapping into existing volunteer networks to set up a network of migrant worker volunteers in big dorms, in sizable dorms, which is really heartening, and it's really possible only when you are collaborating with the employers, with the dormitory associations, and with the migrant worker themselves, because now your migrant worker then become volunteers, which is really heartening. Then we also see, you know, the recognition that there's this whole mental health, mental well-being issue that needs to be looked into more closely, because all these restrictions of movements and this worry about the health situation takes a toll on the mental health among the migrant workers. So how do we encourage the migrant workers themselves to become peer counselors, right? Peer support services. And lastly, of course, ground-up volunteer activities that brings in other ground-up initiatives as well as community groups coming forward to support the migrant workers. Next slide, please. I think this is my last slide. I'm going to do a soft plug here. So for those who might be interested in terms of the collaboration efforts, I apologize, I don't have time to articulate that more fully, but if you're interested, there's a QR code there. So this is a toolkit where we put together the best practices and sort of it's an open and ongoing process, but we're trying to update this as we go along in terms of what are the things that we can do to make collaboration better and more effective. So I'm trying to link this back to the topic that we started with, which is around, you know, encouraging volunteers taking action in recovering period, right? And perhaps, you know, we keep on hearing about building back better, especially now during the development and recovery phase. And I'm wondering whether there's a scope for us to broaden this conversation, right? From a volunteers-driven action, maybe to something that really goes beyond that, right? What's the scope for cross-stakeholder initiative? What's the scope for whole of society response so that volunteers can then do their role even more effectively? Instead of just looking at taking action, how do we broaden the conversation towards collaboration, right? Because collaboration then enables you to take action better and in a more targeted and coordinated manner. And lastly, rather than looking just as recovery of going back to where we used to be, can we broaden the conversation and advance it forward to look at resilience? How do we create and build a more resilient future? So really, how might we enable community-based collaboration towards a more resilient future post-COVID-19? Next slide. I think this is probably my last slide. That's right. Yes. So I apologize. I think I overrun a little bit, Matt. I'll return the time to you. Thank you very much.
Thank you so much, Gloria, for that wealth of information and for leaving us with some really important questions at the end. I am going to invite both Gloria and Denise to turn on their camera, and anyone else who hasn't submitted a question via the Q&A, you're welcome to do so still. We have a brief time at the end, and we've got good questions already in there. So I'm going to just kick us off with a general question that touches on some themes that multiple participants asked about, and it's related to risk calculation. And maybe I'll start with you, Denise, on this. But the general category of the issue is, confronting the COVID-19 pandemic has involved many personal and organizational risk calculations. And how have volunteer involving organizations differed in their calculation and management of risk, and what have we learned so far? And that more specific questions, Christine asked, we have an employee-based volunteering group. How do you manage the needs requests from the community while keeping employees safe and ensuring HR understands the needs for volunteers? Cindy asked, is there a limit to the hours that volunteers are allowed to work in vaccination centers? Allison asked, are the volunteers themselves all vaccinated? Kick us off, Denise, talking about safety.
Okay, so some of the very practical things, Matt. First of all, our volunteers are all being offered the vaccine. Now, they didn't all have it on the first shift, but they all have been offered it over the last number of weeks, and many of them have taken that up. So that is definitely part of our risk management for putting volunteers into the vaccination centres. Also, I think there was a question in there just about employers and businesses, and we have been able to do that as part of our volunteer response on the vaccination centres and more broadly. I think you have to take a step back. Risk management has always been part of life for managing volunteers. This is not new. I suppose what it has done, certainly over the last 8 or 9 months, is pull that to the very front of thinking about it, because it has become, I suppose, more important, and certainly something I think volunteer managers are giving more time to. We are doing the same thing that we always do, in the sense we're taking a structured approach to it. We're asking ourselves, what are the risks? How do we mitigate those risks? Is there more that we can do to mitigate those risks? Can we manage all of them? If not, have we increased our insurance? So we have done all of those things over the last number of months. We've also been very fortunate in that the public health system in the UK has also stood behind our volunteer programme, and has actually taken on board some of the risk, particularly in the vaccination programme. But we've also seen organisations taking completely different approaches. Our organisation saying, oh, nobody who's over 70 can volunteer with us ever again, kind of thing, right the way through to organisations that don't ask any questions about risk and probably should be asking them. I mean, you have that whole spectrum, and I think there's probably a happy medium in there for organisations that want to be taking a sensible and well-managed approach. I certainly feel that we have managed to do that over the last little while. But there's risk in everything, and it's just how you make that work for you as an organisation.
Thank you, Denise. And Gloria, I'll give you a chance in asking you a new question if there's anything you want to add to that particular topic. But let me kick a separate topic over to you, Gloria, to help us think about. Sylvia from Sao Paulo, Brazil, speaks about virtual volunteering or hybrid volunteering. How can these models, as promising models, but models that have the potential to potentially alienate older people that aren't as familiar with technology, and how moving forward do we strike that balance to take advantage of what we've learned about virtual and hybrid volunteering, but to do so in an inclusive way. And Abhishek also asked very more specifically, virtual volunteering, what things are being done to work with virtual volunteering to support vaccination efforts. So either of those questions, Gloria, do you have anything you'd like to share?
Yeah, certainly, Matt. And thank you so much, Abhishek, and for the question. I think definitely when it comes to virtual volunteering, we would risk sidelining people without ready access or familiarity with digital devices and with how to get on board and stuff. But based on the experience in Singapore, I think what is really heartening is that you also see this concerted effort of getting the seniors on board the digital space, right? So we have actually many youth and many schools deploying their younger students in order to bridge that generational divide, to train seniors, be it as beneficiaries or even their own parents, right, in order to get more familiar with the digital devices and therefore being able to leverage on the virtual volunteering opportunities. What we've also seen is that in Singapore, there is an organization that focuses very much on galvanizing senior volunteers. They're called the RSVP, Organization for Senior Volunteers, and they themselves have senior ambassadors. So that's really, really interesting. So they have senior ambassadors who are specifically trained with digital literacy, with virtual opportunities, so that they are then able to become ambassadors and train the other seniors, because they probably understand the pain points a little bit more. So I feel that there are some efforts in helping us to bridge this divide. Of course, this is a necessary step before we are able to amplify the usage and the reach of virtual volunteering. And yeah, I don't really have a specific examples for vaccines, because I think we haven't quite, I haven't quite tracked that part that much. But what we have also seen is that in the thick of the movement restriction period, I think people have just been amazingly innovative in terms of their approach. So we have seen people with coding skills just sort of come up with online translation devices, or even with apps, so that they're able to see the various opportunities and needs within their neighborhood. So I think there are a lot of avenues in which the virtual space provides us with more opportunities, as long as we're able to bridge that kind of digital divide, which takes a whole society approach.
Thank you, Gloria. And with apologies to anyone whose questions we can't get to, I'm going to finish with one final question before leaving you with an invitation for our next engagement, and we'll close up in the next couple of minutes. But I think it's related to the fact that many volunteer organizations that are working on issues related to the pandemic aren't necessarily organizations that have a lot of experience working on issues of health. And so when we're talking about getting into the space, into the networks, in order to be able to work with a public health response, Allison asks, can you say anything about the relationship with the health system? And maybe I'll frame that even broader, that we've been living with this novel coronavirus and everything is new for everyone. And many organizations aren't part of the public health system and community. To what extent and how, if so, should organizations proactively push themselves into the mitigation, response, and recovery space if they are not invited? Maybe we could start with you, Denise.
I suppose I think it depends whether they feel they've got something useful to add. I mean, I think if they've got something useful to add, we've seen our health, which is a very formal structure, it's a very formal public health structure, flex to the extent where I had a senior manager in one of our health trusts 6 months ago say that they couldn't be delivering their response without the volunteers, and that would never have happened before. And we're hearing the similar message about the vaccination support that we're providing as well. But it is a very structured environment, and they are very focused on their policies and their procedures and their health and their safety. So in a way, you have to flex what you do to fit into that culture, I think, as well. And there has to be a bit of meeting in the middle too. And certainly that's been important for us.
Yeah,
Gloria?
I would probably echo that. So I think from our experience here in Singapore, it's not it's not so much a matter of proactive pushing. I think what we see is that pushing one's way into the space, although you're armed with goodwill, right, requires that coordination with existing players, because I think traditionally we are all so used to work within sort of like, you know, this is my domain and this is your domain kind of thing. And therefore, when there's a crisis happening like this, when you have non-traditional players sort of coming into a space that was traditionally not seen as theirs, I think that tends to create confusion. So what seems to be quite useful is, regardless of whether, you know, the extent to which you want to be proactive about this, I think the bigger question is about coordination, and maybe who should be doing that coordination, right? Who should be saying that, hey, you know, in this space, I think, you know, we might need we might need an outpouring of support, and therefore let's create additional space for the community players, for example.
Great. Gloria, thank you. Denise, thank you so much for sharing your perspectives as we all learn together across the globe about how we can work together to confront the challenges we face, especially as we mobilize volunteers in this process. I would like to thank all our participants for joining. Thank you all for the good questions. Apologies to anyone for whom we couldn't get to your questions. Please, some of you have asked, you know, how can you become more involved with the International Association for Volunteer Effort, IAVE? Please join. Check out our website, iave.org/join-now, so that you can receive invitations to conversations like this and be involved in other ways. We are one community. We seek to share effective practices, and so that we can all get better together. And on that note, specifically, our next session of this series is on May 6th. It is the final webinar of this series, and on the volunteering for social change, the importance of partnership. So there is a link to sign up for that session. If you haven't already, please do join us. And once again, Wendy, thank you for the invitation, and Denise and Gloria, thanks so much for taking the time to capture your learning and help us all move forward. Everyone, please have a good evening, afternoon, or morning, and stay safe.